Hi everyone, I wanted to talk to you today about my medication that I take for my AS and how it works. The first one that I want to talk to you about is the biologic that I take. It's called Imraldi. It's an injectable pen. I take that every 2 weeks and it's literally take the top off, jab it into your leg or your stomach, let the injection go in, and it's job done. That has the biggest effect on AS and its symptoms. The way it works is pretty clever. So my immune system is confused with AS. My immune system doesn't know when a joint, for example, is damaged or healthy, so it would send a message to that joint to tell it to fix itself. So basically my immune system wants to fix parts of my body that aren't broken. Where Imraldi comes in is that it has a type of protein within there called adalimumab, great name, that attaches itself to the chemical messenger in the body called tumor necrosis factor, or TNF. This messenger is involved in causing inflammation and is usually found at high levels in patients with AS. But the adalimumab, I can't even say it, by attaching itself to the TNF, it reduces the TNF activity, and therefore reducing inflammation and potentially other symptoms of the diseases. The second medication that I take is called etoricoxib. Etoricoxib is an NSAID, or non-steroidal anti-inflammatory drug, and the way it works is by stopping the production of compounds called prostaglandins in the body. But basically, prostaglandins have a number of effects on your body, including inflammation, those sorts of things. And NSAIDs, particularly etoricoxib, basically stop the production of that prostaglandin. Some of the other medications that I take are something called omeprazole. This is taken in conjunction with the NSAIDs. NSAIDs can cause serious stomach problems over a long period of time, and as I take the NSAIDs daily, I need the omeprazole to counteract the stomach issues that can come with it. The main problems that you can get are things like stomach ulcers, those sorts of things. I also take codeine as a painkiller. That is something that I've been taking very recently. Initially I took it at 1 dose and then I had to up it to the next dose, as it wasn't killing the pain as much as I wanted it to and as much as the doctor thought it should do. So we doubled the dosage. I can't go above a certain level, unfortunately. I also have epilepsy, so codeine causes the epileptic drugs that I take to be less effective. So the more codeine I have, the less pain I have, which is great, but it means I'm more likely to have a seizure. So I've got it at that balanced point where I have as much pain relief as possible without causing problems with the epilepsy, which means that I haven't had a pain-free day for a long time, unfortunately. I'm not likely to, as far as I can see, but it's better than not taking the painkillers at all. Other supplements I take are things like turmeric, which has anti-inflammatory properties in it. I take a probiotic, I take glucosamine, I take omega-3 fish oils, I take multivitamins, and I take iron. These are all on a daily basis. If I don't take them, I certainly do feel worse the next day. So it's something that I do need to take and maintain all the time. I take pregabalin for anxiety and depression, which go alongside AS. So a lot of people with AS and people with chronic pain that have associations with anxiety and depression. Chronic pain is linked quite heavily to depression. So I take pregabalin for that. It's not ideal. Chronic pain, I'm well aware of the long-term effects physically and mentally of chronic pain. Any medication that I can take that will help that, I will. But that doesn't mean to say that I can just rely on medication. With that medication, I've still got to do all the other things. So there will be hydrotherapy, physiotherapy, stretching, yoga, everything that I can possibly do on a daily basis to help reduce the pain and the symptoms, to make my life manageable, basically. So that's what I take on, from a medication point of view, on a daily basis. If you've got any questions about the medication, please leave them in the comments below. If you've got any questions generally about AS, again, just leave them in the comments below. I'd be happy to answer them. And in the meantime, I'll see you later.